Well, good morning, everyone. Before I became an investor in education and brain technology, I was an executive at a Fortune 1000 company. It was called T. Rowe Price. And as I moved up the career ladder and began to manage more and more of the business, I fortunately learned that the whole name of the game is to get your human capital to perform well. And that essentially companies need to have the talent and ability to respond to the environment and make changes appropriate for the sustainability of the business in a rapidly changing environment. So performance was very important. And in coming to grips with that, I realized that it was important to hire and create the capacity of people to continue to learn. And particularly as the industry I was in began to change more rapidly. So accelerated learning, which is the topic of today's conversation, I think is relevant for every institution in this country, whether it's public schools, corporations, government, or even the military. If you think of the conventional way we kind of prepare people for life, it starts in your home where hopefully you have an enriched environment and curiosity in the family, but then we entrust it to this public education system. And really the narrative there is better teachers, better curriculum, maybe blended learning. Every 10 years we go through a philosophical revisions, and what we think the standard of education is currently called Common Core. But interesting enough, there's very little narrative currently on the capacity of the learner to become more proficient.
Sure.
Right?
Yeah.
So part of the conversation today is, are we at the point where, just what Adam talked about, can some of that capacity be brought into classrooms, either through the delivery of the content in ways that allow for greater assimilation, or in actually improving the capacity of a learner to be proficient, right? There are really two pathways here. At the same time, the workforce, there's greater competition, the world is changing more quickly. How do we upskill talent? And can we do it more quickly, and can we do it with more fidelity to be able to execute on the performance of that skill under various conditions? So we have assembled a really interesting panel who all through careers and interests have come to the point where they are beginning to bring the exponential technologies that have been discussed over the last day to bear on this question. Can we create greater human performance through the application of combining neuroscience with these emerging technologies? So to start the conversation today, I'm going to ask each panelist to briefly describe a little bit of their background, of how they came to be interested in this field, and then what their role in their company or what their current pursuit is. Amy?
Sure, yeah, absolutely. Amy Cruz, currently the Chief Technology Officer for Cubic Global Defense, which is as it sort of stands for, global defense company. We do a lot of work in training, communications, combined training centers across the globe. So a lot of work in actually military training. My background is neuroscience. I have a PhD in neuroscience. Was a program manager at DARPA. And while I was there, started quite a few programs in the use of neuroscience technologies and human performance optimization technologies to actually accelerate learning. Actually, I had a program called Accelerated Learning, so I absolutely love the term. And have been essentially for the past maybe 10, 15 years taking some of those things, what I call out of the lab and into the field, and actually turning them into fielded products. So that's what I'm up to.
Hello, my name is Luis Soros. I work at Pearson Education in their Future Technologies team. So our team primarily focuses on exploring new technologies or trends through the lens of learning to answer three questions. What problem or need does it address? Can it solve it? And what are the potential business opportunities? A lot of this I've always loved the brain. I studied it in undergrad and became fascinated, then did Teach for America. But when I got into the classroom, there was a pretty big disconnect between what I had just learned about the brain and how we were being trained as teachers. So over 2 years, kind of experimented with iPads and other mobile devices and student-centered learning. So created a classroom environment where I didn't lecture. Kids kind of drove their own learning and took ownership. It was pretty cool, and that work led me here.
My name's Daraj Janandarajan. I am the founder and CEO of QNeuro. QNeuro is a software company that creates educational video games for kindergarten through 6th grade students for mathematics. And we use EEG, real-time EEG recording to dynamically modify the educational content presentation to optimize and maximize the efficiency of learning. My background is as a clinical neurologist and in neurophysiology. We use this technology for in the operating room to improve using real-time electrophysiological recording and feedback. We give feedback to the surgeons to improve the outcome of surgeries. So my idea was to take this and to translate it to the educational space and to say, can we monitor the brain in real time as it's learning? And will that bit of information give us some clue as to how to improve that learning process, make that learning process more efficient? And so far, that has led to the assembly of a spectacular team of people. We've got experts in the field of education, neuroscience, gaming, programming that have all collaborated together to create this very immersive, entertaining video game that the child doesn't know that they're doing anything educational. They're just playing this really cool game. And, but in the background, the EEG is being recorded. The game is being dynamically modified so that this learning that is actually taking place in the game is changing according to that person's specific brain state. So that's where we are. We're moving into the stage of trying to get this into pilot studies into schools. And we're very excited with where this is going.
Hello, I'm Sam Glassenberg. I'm the CEO of XTech Surgery. My background is in the video games industry. So I spent my career building and managing teams and companies in the video game business. I started out at Lucasfilm, LucasArts, making games for Star Wars films. Spent many years at Microsoft, building one of their game platform teams, and then spent many years building a company that ended up becoming sort of the go-to studio for Hollywood, making video games for Hunger Games and Mission Impossible and Rocky. This entire time, so building games with audiences of tens of millions of players. And sort of this entire time, my hobby has been building surgical training tools because I'm the black sheep of my family that never went to medical school. And so this was always a great shame. And so every few years, somebody would ask me to build them a training tool using using the video game technology I was using at work to train some obscure procedure to train their residents or medical students. And what always surprised me was simulators that I would build with old game technology in 2001 would continue to win prestigious medical education awards in 2007. Not to say that what I was building was any good, because it wasn't. It just was demonstrating this massive gap between the state of the art in entertainment and the state of the art in healthcare and keeping surgeons up to speed on how to deal with difficult scenarios. And so a few years ago, I ended up building a surgical training tool, same story, that ended up rallying an audience of 100,000 ENTs and anesthesiologists, at which point I realized that I really started delving into what was the state of surgical education and how do we keep doctors and surgeons up to speed on how to deal with difficult scenarios or how to use, how to do the latest non-invasive procedures, and quickly realized that it's a disaster. And all of the many of the problems that they have, whether it's how to accurately simulate the behavior of the human body, the behavior of tissue, or even just how to do training or analytics and how to distribute content and how to enable doctors to engage with this stuff. All of these problems we have solutions for from the games business. And so that triggered the inception of XTech Surgery.
So just a little moment at the X conference. I don't think I knew that you guys, Daraj and Sam, you came out of a surgical background and you got the idea for schools. You came out of a gaming background and got the idea for surgery. You're sitting next to each other. Do you want a moment to put a deal together and then we'll continue the discussion? This is what happens when we all get together like this. So, Amy, I'm going to come back to you because you said you actually had coined or used the term accelerated learning?
Yeah, back in 2006.
Back in the day.
Back in the day.
Yeah.
Yeah,
So-
actually. Yeah.
So when you coined it, what did it mean then, and has the definition changed?
Sure. Yeah. So when I coined it then, it was actually again in the context of the Defense Department, and we were looking at whether or not I asked two questions. One is, are the brains of experts different than the brains of novices? So do they appear from a whether it's MRI or EEG or some other way? Are they different? And then if they are different, we suspected they were, right? But if they are different, then can you use something about what that expert brain is to actually accelerate a novice along that trajectory from sort of ground zero to not necessarily mastery, but somewhere along that trajectory?
Could you, what did you find? I'm sure the audience would like to hear that.
Absolutely. So we found that you can accelerate learning. One of the most successful things that we did was actually in marksmanship training. So essentially showing the brains of marksmen, expert marksmen, have a very repeatable brain pattern that they enter. They essentially enter this zone. They have very repeatable signatures that are associated with that, and then they sort of take a perfect shot. And you can actually train novices using a neurofeedback paradigm, very simple closed loop system like we've been hearing about. You can actually use that closed loop paradigm to train novices to get themselves into that state. And what you find is that by doing the neurofeedback or brain training alone, you actually improve performance on the range. So they don't actually have to shoot any more bullets or synthetic bullets or virtual bullets, but you can actually get them into that zone. By doing that, and there were other examples as well, but that's just one that now that we're actually turning into a product from the.
So to develop this a little bit further,
Yeah.
were you observing? Did you find your experts?
Yes.
And did you find an EEG signature that indicated high performance
Yes.
as a biomarker, and then
Yes.
you trained up novices towards that signature?
Yeah. Absolutely.
Pretty cool.
Absolutely. Yeah, and that was a very, that's kind of a motor task, right? It's a marksmanship task, so I think it had some nice attributes to it that made it suitable for that type of intervention. But I think every time we've looked, and this is, you sort of asked me the question of like accelerated learning now and then, I often tell people that the things don't necessarily pop out at you, but every time we've looked for a way to accelerate learning using neuroplasticity or some other type of intervention, we've been able to do it. But it's not like, you have to, in some cases, whether they're task specific, you have to kind of delve into them. So.
But I think it begs the question, some of the early, I think, outcomes in accelerated learning were very task specific.
Yes, absolutely.
But then if I think about, is surgery a task or is it an Sam, are you going to train up to a task using gaming? But then, Diraj, I think in your case, are we just making somebody giving more capability in a generalized way to learn over a range of things? So are we broadening the definition of accelerated learning to be a competency rather than task specific?
I mean, I think we have to, we're taking education, as a broad term, but we're specifically now focusing in on mathematics. And within mathematics, you have a specific task within mathematics that you're trying to master and solve and get those signatures for mastery and then work up to those signatures. So it does kind of still go back to a little bit more task specific. You have to kind of take it down to that level once you identify the specific task that you're trying to achieve mastery of and accelerate the learning to the point of achieving mastery of that specific task. So I think you've got these very kind of broad-based umbrellas that it falls under, but you still have to be able to identify, and that's one of the beauties of we follow the Common Core system in our educational system, and so that gives you specific tasks that you have to, these specific skills that you have to master in order to understand that specific concept. And so we create task-specific, assessments, exercises, and things around that particular concept that you have to learn. And now we're measuring EEG in the mastery and performance of that specific task.
So I think to maybe just directly answer the question, studies have shown that surgeons who play video games perform better in surgery. They have faster outcomes, better outcomes.
When they're
they
in
train
surgery?
faster.
Yeah.
Well, they've even done studies where they play a game right before surgery and then measure performance, and it improves just the action, the hand-eye coordination, getting you into flow is beneficial. So I think we've already seen countless examples of how video games provide, we'll call it an unintended consequence,
Yeah, exactly.
right? To use economic terms, an unintended consequence of playing video games improves outcome and performance. And I think you can see this among surgeons, and you can see this even among 7-year-olds. There's a reason why every 7-year-old, right, might not know his times tables or her periodic table, but he or she can name 300 Pokemon characters and give you their entire backstory, right? That wasn't an intended consequence of the game. It was just something that happened by virtue of them playing for 100 hours, something that they were enjoying and having fun doing.
Lisa, let's circle back to you. You're an innovator in a large global juggernaut that is trying, quite frankly, Pearson, which I think is the largest education publisher in the world,
Correct.
is also trying to evolve to be relevant where the packaging of content is less important than the performance of the teacher or student, right?
Yeah, I'm sure you guys are familiar with the concept of innovator's dilemma. You know, the processes that lead your company to success are the same reasons that will prevent you from actually investing in new markets and when you need it most.
Right.
Yeah, we face it every day. And in terms of accelerated learning, you know, there are two buckets that we constantly struggle with. I think on one end, you have our kind of traditional models in schools where I think in their view, accelerated learning is the kids get through the prescribed curriculum faster as measured through summative tests.
Right.
And that's it. And anything that does that, that's great. It makes sense. Anything outside of that is a deviation and a luxury.
So that's kind of time on task
Yeah,
performance?
exactly. And you'll see, I mean, I think that's some of the measurements that you see at that level. But then there's a much more interesting space that I think personally around learning competencies and applied skills. You know, and in that sense, accelerated learning for me becomes, you know, how do I learn a skill and close the gap between why I'm even learning it in the first place, right? So for a game, you know, I'm gonna learn how to jump over that barrier because I really wanna get to that new sword or whatever it is. Like there's always a motivation that we think really interesting. It's difficult, you know, a lot of our current business is in the traditional bucket. And I think trying to get the right stakeholders to invest in markets that frankly, sometimes are small, or, you know, for a $10 billion company to say we're going to grow 20% in the next 3 years, that's, you know, like a $2 billion markets we have to find. Yeah, it's a challenge.
So do you think that the market will develop, which is more the introduction of exponential technologies, maybe virtual reality or augmented reality as a teaching tool in the sciences it works really well? Or is the end game really to incorporate those tools, but as our understanding of the brain, of executive function, of the relationship of neural circuits improves, ultimately will companies that are in the education space be expected to improve the capacity of the learner to learn? So is there like a staging of what accelerated learning means, but in 10 or 15 years, is it, I want to work with people who will make me a better learner, and that just isn't attitudinal, it's functional.
Yeah.
Is that where we're headed?
Yeah, you know, surprisingly enough, you know, the pursuit of education for knowledge is actually a very small percentage of the population. You know, most people in the world look at education as a way to advance their life, right? It is, my outcome is, I want to get a good paying job in an in-demand field to support my lifestyle. I think you're starting to see alternative models emerge around, I can be cheaper, faster, more flexible, and guarantee employment. And in those models, it tends to be these kind of applied skills, these competencies. That's the space that I think there's a lot of interest and potential. Even in our prototype, I mean, we've built, you know, 45 plus proof of concepts over the years, or 4 or 5 years. We've always had a really hard time implementing a new technology in our traditional models and channels. You know, you know, I feel like too often the phrase that I hear is, this will revolutionize education, and it doesn't happen. I think where there's interesting opportunity is when you place pedagogy before technology. And I think if you view experiential technology through the lens of pedagogy and how the brain actually acquires information and for what purpose, there's a lot of opportunity there, especially in employability spaces.
Sam?
Yeah, so I'm on to address sort of the VR, AR question. So I'm on a number of industry advisory boards from companies that are heavily invested in virtual reality. I've seen some behind closed doors demos that just blew my mind, and you know, just completely remove any, you know, like completely cross the uncanny valley, and you know, they suspend disbelief and whatnot. That being said, I think that we are still, even before we get there, there is so much already going on in the entertainment business and the video game business, and so much technology and capability that it's already 10 years, 10 or even some cases 20 years or even longer ahead of education in different fields, that if we just take advantage of that we need to take advantage of some of that first, right, before we all start putting on headsets. And I think to even sort of expand the notion of sort of accelerated learning or how accelerated learning is interesting, maybe I need to pick a new buzzword for this concept, but what's interesting for me is accelerating learning from the standpoint of the content creator. Because this is something that I think we are very, very good at in the games industry, and I don't necessarily, and I think, and this is an area where I think really the most interesting innovation comes from, which is this idea that when we're building a game with 20 million players, right, we are constantly learning ourselves about that audience. Right? We're not putting electrodes into people's brains, but we have an audience of an experiment base of 20 million people. We are literally running thousands of experiments at once, changing different parameters, adjusting gameplay. We have hundreds of versions of a game out there in the field. We are testing everything, collecting massive amounts of data, and trying to distill what drives more engagement, monetization, and so forth. So I think whether your target is improving learning, whether your target is improving monetization, whether your target is just getting a user to play your game for 300 hours instead of 200 hours, or your educational app, the creating the framework to accelerate your own learning is very important. So how do you create something where you can put a product into a market in front of a large audience? You can change. It's totally versatile, so you can change all the parameters and you can test the outcome very, very quickly. And so within a matter of days, you start getting data back, and then you do another test. And this is something where the games industry does this with 1 billion players en masse to distill all of these concepts and really distill this down to a fine whiskey.
So when I hear that, and I've spent 7 or 8 years trying to move the needle in public education. I was incredibly naive when I thought I could move the needle, right?
You're optimistic,
But Sam, your philosophy is so different than K-12 education, which moves incrementally at best. And so it's really going to be fascinating to see how the philosophy of Sam and his community, rapid prototyping, rapid learning, rapid adjustments, right? Interfaces with K-12 education or a company like Pearson. Is there room for thinking like this at Pearson?
Yeah, it's us.
Okay, yeah, good.
No, and we have a community, that we try to work with other people. I mean, people want to change. I mean, at the end of the day, I think you can hear any company, and there's the stories you hear in the news, and then you actually talk to the people, and oftentimes they're really good people. They really want to change. They want to do good. It is a for-profit company. I think the most interesting K-12 space I've seen are like boot camps, after-school boot camps, using Minecraft, and they actually do use virtual reality games and headsets, and that's really cool. Their main customers tend to be parents. But I think that's where, so alt school, for example, alt school is, I don't know if you guys have heard of it, it's a really fascinating model. It's like progressive educational model in the K-12 space, but they embed their designers, their developers, their entire team in the school in real time, 24/7, similar from the lab guys we heard yesterday, embed your team. And from my understanding is that they're really interested in, can we build a platform that if we were then to take into more traditional environments, that the foundation is there where it can scale. And these new kind of, dare I say, progressive experiential technologies are now viewed as a way to kind of help that learning, as opposed to how am I going to use this technology to deliver content more efficiently.
Right.
And a couple of points to what Sam had mentioned too was, I agree, we have designed our game, to be in a 3D environment, very immersive, but we started with the iPad because everybody's got an iPad. The schools have iPads, so we didn't want to jump into VR because we have no audience for VR yet, Someday that's gonna happen, and we've designed everything so that we can easily port to that when the time comes. But for now, we've designed it to be for what's readily accessible, what's readily available. And I 100% agree with the fact that we can we've built in, so we're getting metrics from our game, and we're constantly learning from, what type of student in what type of environment, when they're presented with this, are they getting it correct? Are they getting it incorrect? How are they getting it correct? And now if we're matching that with the EEG data and their brain state, that adds a whole new dimension of information that we can now use to actually improve learning, improve learning across the population. The bigger this gets, the more data we get, the better this is going to become.
I wanted to anchor this back to sort of from my perspective, the military training perspective, and it's interesting because we have to, right? We have to use a virtual training environment. It's too expensive and too much gear and too many people and in terms of budgets and everything else. We have to go to a virtual training environment in the military, from the military perspective. And so we're a part of efforts now that are looking at how do you build virtual test beds using gaming technology, using augmented reality or virtual reality to simulate things on the sort of playing field or battlefield that you wouldn't normally be able to do or that would have been very expensive to employ. And so I think we see the pull for experiential technology in the military space just because we have to, right? And then I think from a individual perspective, and I've made this commentary before, I think people are more comfortable with data about themselves. And as we've seen the revolution in wearables and sensors and data collection, I think where that population may have been less comfortable with metrics and cognitive metrics and those types of things, I think we see a transition there, as I think we see that transition in education. And as I think it's spreading, that aspect of accelerated learning is spreading across many fields because of comfort, scale, need, desire. Not every kid is going to be able to be in an immersive classroom, right? But they may be able to have an immersive experience individually in a space that they're in. The same thing with distributed training from a military perspective.
If I can add to Amy, we talk about all this friction in the K-12 space, but where we don't see friction and open arms and people actually wanting to work with us a lot is in vocational training or anything that requires, it's really expensive. There's a lot of value in rehearsing it before it actually happens in real life. And I need my employees to act on it when they need it. So one prototype we built was using Oculus Rift and Leap Motion to train people on oil rig emergencies. Right? So we know that in high stress environments, adrenaline shuts down your prefrontal cortex, right? This is why the military spends so much time in rehearsals but it's really expensive.
Absolutely.
So the prototype started with a very basic, you walk through this kind of rig with everything removed, put out fires, and each level adds another level of sensation or extremes. It was really fascinating. Those are the places where we see there's a need, there's a hunger for.
Well, and just in terms of something very practical right now, we're building an entire game-based learning system for the Navy on their new littoral combat ship system. They are only doing digital training. That's it. There is no big iron simulator somewhere that somebody's going to sit in front of and use. And so that's, you see that pull, and that gives you then a platform, I think, to build on to add additional technologies, right? It's not that much harder to take something that's already built in Unreal 4 and add a virtual reality experience or add sensors.
Well, so what I'm hearing is that we're really beginning to create practical solutions.
Yes.
Where there are outcome measures. I presume that knowing the U.S. Army, and I don't know if you work across the military branches, but they're very data-oriented.
Very much so. Outcome is
and they're very outcome-driven,
yeah.
and they only do things that show that you can improve an outcome. So I think I'm going to stay on that because, Amy, you and I chatted about this last week. As an investor, I think, what's going to drive change? Where's the adoption curve? And in this kind of accelerated learning education, what's really fascinating is the vision the U.S. military has in our country around cognitive dominance.
Absolutely.
So think of them
this is exciting
as
for me.
one of the biggest employers in the country, not the largest, and they have a vision around this that I would say is even more innovative than Goldman Sachs or BlackRock or people like that. Could you just share a little bit?
Yeah, sure. So over the past few years, the U.S. Army has come out with their human dimension strategy. So it's essentially starting to integrate the cognitive and cognitive capabilities and cognitive training into something that was very much a physical fitness and sort of physical domain. So they've started to realize that this is very important. I honestly think it was spurred on by some of the experiences that they'd had with post-traumatic stress disorder, and realizing the impact that stress had on the performance of individuals. We've been, from my perspective, we've been working on this for 10 years, right, to get the larger entity to realize, but now we have the right language in place for people to sort of hang things off of, right, that we can now say that we have solutions that will improve cognitive performance. I gave a talk recently to the Training and Doctrine Command thinking about cognitive fitness as well as physical fitness in that domain. We're very attentive to our military personnel and their physical wellness, but how is their cognitive wellness, how is their mental wellness addressed? And now we have something to hang that off of. So I think we're going to start seeing applications, call for papers, call for things in this space as we move forward. But I'm thrilled with the language around that and the people that they've put behind it. Not just language, but actual individuals.
There's a company here where the CEO and Chief Scientific Officer are here from Cognizant. I think they're in the back of the room, but they do a lot of cognitive training for SEAL Team 6.
Yeah, exactly.
And it was, I think what the military discovered was there was something about the ability to shift a brain into a higher level of stability, particularly under stress, that they got with their elite performers who go into very stressful situations that under stress need a high level of acumen around judgment, right? Instantaneous judgment, because lives depend on it, and then the rehab from TBI and that science is now being brought into this bigger platform. So Sam, I want to go back to this question of the pace of adoption. So you bring this great area of practice in entertainment now into the field of medicine to essentially make surgeons more proficient so there are fewer errors. I presume that when you go talk to hospitals, I can lower error rate, right? But what are the secret sauce of what you've built at Lucas and elsewhere that are going to get surgeons to engage around the tool and actually use it enough that you can see better outcomes?
Right. So I think adoption is a very interesting subject because you have actually in healthcare is this massive sort of adoption gap, right? Because adoption is not just sort of this broad term. Things are easily adoptable or not, right? What factors into adoption is barrier to entry. So one of the major problems that you have in healthcare, and specifically in surgery, is you might be able to do a certain procedure endoscopically, right? It's minimally invasive, you don't have to slice the patient open, you can just do it all through an endoscope, and the outcomes are much, much better, right? And so this is amazing. The problem is adoption, because because a doctor who's been doing the same thing for decades, right, has no real opportunity to train that new procedure except potentially on a live patient, right, which they're terrified of doing because their first 100 procedures are always going to have the worst outcomes, right? So now you've got this horrible adoption gap. And how is that addressed now in healthcare? It's terrifying. So you either have the live patient thing. This is why you never want to go to a hospital, what is it, in July when the residents...
you don't want to go to a teaching hospital early in the academic year.
But even for very well established doctors, right? A new device comes out, right? That's revolutionary, right? But it substantially changes the procedure. How do you learn about it? Cadaver labs. You fly across the country, you go to a cadaver lab, and you basically perform the procedure on a dead body. And it's a cadaver lab, so you get what you get. Right? If you're trying to train on a procedure, you want to do something where, a colonoscopy or something, you're trying to detect polyps, there may be polyps in there may not be, right? And so there's this huge gap, right, for adoption. And so, but on the flip side, right, if you look at gaming, right, adoption is our business. Right, so we have this channel where we can reach massive audiences very, very quickly. And what you see among doctors is if you give them utility and the barrier to entry is low, right, they will adopt very quickly. This is how I got into this whole thing by accident, right? I put something in the App Store, and next thing I knew, I had 100,000 doctors using it by accident. And so if you can, so where things get really interesting is if you can sort of close that adoption gap, right? Can you use the low barrier to entry distribution channels, right? And then use that to train doctors on the difficult procedures and the difficult, once in a lifetime cases or the new equipment, without having to use a live or dead body.
So I'm going to push a little bit further beyond what was kind of scripted here, because we actually gave that up about a half hour ago. But
Yeah, I'm sorry.
it's good. No, it's great. So, because I really believe you got to understand your models here. So, who's the buyer of your service? Is it the doctor, the hospital, or the surgical company, or all three?
Oh, this we haven't. This is where we this is where we distill. So one of the things that the video games industry is exceedingly good at, in addition to engagement and learning and all these other things, is the way with which we is our revenue models, which are also 10, 20 years ahead of other industries, and by demand, right? Because we are traditionally targeting audiences that don't spend large amounts of money, right? Especially if you look at, for example, gaming in developing markets like China, where there are these multi-billion-dollar industries made up of people spending very little. And so the games industry has become extremely innovative in finding ways to generate revenue off of content and basically create virtual economies, basically, where you can have participants participating in a wide variety of ways and bringing in revenue from a wide range of channels. So certain users may be spending substantially more, certain users may be paying substantially less, and then you create a virtual economy that enables those trade-offs. And we have tons of tools on the back end in order to optimize that. And really, literally, there are games like EVE Online, which was made in Iceland, which has one of the most sophisticated, it's a video game taking place in a sci-fi game in a future galaxy that has one of the most complex virtual economies in the world. And so when the Icelandic economy crashed, they brought in a bunch of the PhDs who've been working on the virtual economy in EVE Online to go and figure out, to assist in how to do that. So this is one of the areas we're talking a little bit less about, but we're bringing in a lot of these models from the sort of business and revenue models and sort of the non-invasive, non-intrusive ones, and how we can go and bring that into healthcare.
One of the points, not for this one in particular, the question before, was I think it's important also to realize, though, that we are creating tools and they're just that, they're tools. This technology serves as an additional tool for the teacher in the classroom or for the parent at home in order to have their kids learn it. For your particular applications, these tools are invaluable to give multiple different scenarios that they wouldn't otherwise get exposed to until they've seen that particular patient. Right. And they might have passed through their residency without necessarily seeing that particular procedure, or not that particular procedure, but that particular complication in that particular procedure. Whereas if they've seen it in the virtual environment, then they have that much better faculty to deal with it when it comes to the real world environment. But it's not a replacement for, you still need the tactile. I mean, we're not there yet. Maybe we'll get there someday, but it's an additional tool that they can use that definitely improves the final outcome and the final performance. But it's one additional tool that they can use in that whole line of training that they have to do. First, probably virtual reality and cadaver lab. Then they go in, train under an experienced physician who knows that procedure. They get trained on live patients as they do that, first observing, then they do it themselves. Then they finally go to doing it themselves.
So both of you may know this, but has any teaching medical school built a virtual reality lab?
Many of them have. Almost all of the really prestigious large medical schools have what we call sim centers.
Yeah.
Right. And so the model there, they combine usually both virtual and physical simulators, these giant, $150,000 mannequins that have heartbeats and things like that. It's incredible how that technology has advanced. But I think the way we look at it is the model for the simulation center, right? Is I'm a doctor. Let's say I'm a practicing physician, and I want to learn about a new procedure or a new device, and I want to then go learn about it. So in Chicago, for example, where I'm from, if my father, for example, wants to train on difficult airways, the best sim center that we have in Chicago is 2 hours away in Peoria. So he drives for 2 hours to Peoria, sits down, loses a day he's not spending with patients, trains in some sort of simulated environment, earns a few hours of CME credit towards his licensure, and then drives all the way back. We had this model for engaging with content in the video games industry 30 years ago. 30 years ago, when you wanted to play video games, you hopped in your car and you drove across town with your roll of quarters. Because, oh, by the way, going to the Sim Center costs a few $1,000s. You get in the car, you get your roll of quarters, you drive across town to the video arcade, right? Why is everything all in one physical location? Well, the cost of equipment is high, the cost of maintenance is high. So there you go. You go to the arcade. People don't go to the arcade anymore. You haven't done that for 20 years. And yet, the state of the art in medical education is the equivalent of Pac-Man.
Yeah.
And so this is what we need to fix now.
But I think this speaks to the use cases. I mean, we're all touching, I feel like, on the same use cases. I have something to do. I need to learn how to do it. And a lot of these technologies that close the gap between what I'm learning and the reason I'm learning it are the ones that are actually like getting traction, user base around it. You know, one of the things that someone told me once that kind of blew my mind a little is like, it's actually private industry that dictates educational policy. It is what private industry chooses to accept as a credential that dictates kind of what the educational models at the higher level. So what we're kind of curious to explore is if we find all these use cases of kind of exponential technology in these corporate private environments, how will that affect educational models that try to align more closely to that, and then ultimately maybe even the K-12 models? Like that trickle down is this pace that we're really fascinated
Well,
by.
That's very interesting.
well, my hypothesis is that actually, if basic training evolves,
Right.
there'd be cognitive fitness and physical fitness. Some of that will translate into Title
I
I
agree.
schools in no time at all. And it's really will be worth taking note of that adoption.
Yeah, well, I think a lot of times we've been, a lot of us who started in this, kind of started from the bottom up, but I think it is now, the market is probably going to be top, the pull, top-down driven, especially I think in education as well. I think that's a great point.
Yeah, the two kind of business trends I'll just throw at you guys is this idea called micro-credentialing and, what's the other word? Now I'm blinking. Online talent platforms, right? So there's this belief that there's going to be technologies that improve the efficiency between the job that needs to be done in whatever industry and the credentialing body that is able to do that, and the platforms that match that are the ones that are going to start moving. I mean, like LinkedIn's perfectly positioned for a lot of this.
Yeah.
But one of the things they're struggling with, as many others, is where I'm really excited with other technologies or like effective computing and other is how do you measure what was previously considered not measurable? Like, what does critical thinking look like? What does creativity look like? Like all these things that are so valued in the workforce, like I'm excited at the prospect that some of these technologies will allow us to actually measure or quantify or develop.
Yeah, I agree.
So you could develop the proficiency, but you could also test for it.
Yeah.
So we haven't even talked about assessment. And
Yeah.
I think assessment is a really interesting unifier of everything we
across
talked about.
across
Will
the
there be,
spectrum.
do you build assessment in on the surgical game? I mean, is there a
Yes. Yes, we do. Do we build assessment into the surgical game?
way? And who gets to see that information?
Oh, so that is also a very interesting question. But look, I think where this all gets very interesting, and again, even around sort of some of the soft skills, right? The video games industry has actually learned how we can measure user creativity, right? Through a lot of the what we call sort of sandbox experiences, like The Sims and things like that, where some very interesting studies have been conducted on just the data of tens or hundreds of millions of people playing a game where they're given full flexibility to explore a world, create what they want to, and then you can sort of measure what are they doing. So one of the things that we've become exceedingly good at in the games business is measuring literally everything you do in a game. You may not realize it, but the second even before you get into Candy Crush or Angry Birds or anything, we are collecting data and observing everything that you're doing, whether you fail, whether you succeed, how long it takes you, how does that impact whether you come back, whether you spend money, how you improve your own performance in the game, and so on. So this is, we have, at this point, we have like off-the-shelf tools that in many cases do this for us. And I think when you look at education, especially sort of in the healthcare space, there is this, the way that they do assessment is very rote, a sort of multiple choice question. And they're very proud of this because we've got quizzes, and quizzes are fun. And quizzes are like games. And so we have games and quizzes. And so this is completely, when is the last time in school you were excited about a pop quiz? So in the games business, we're constantly assessing just by just by virtue of you playing the game or engaging with the content, we are constantly assessing, and we're continually looking at these huge data sets and distilling insights to figure out what should we be looking at and what should we be using as a proper assessment to distill between the users that are performing well and making progress faster and the users that are falling behind.
Yeah, from our perspective, the assessment part is such a huge integral part of what we're doing altogether. So we've got these Common Core standards, and we've got these teachers that are still, getting their heads wrapped around it, trying to figure out, how to design curriculum in order to meet these standards and in order to teach their kids this in the most effective way. So we have a solution for them. We have a tool for them that they can use in order to assess their kids, assess their knowledge of it. And if they're deficient in it, then there's certain things that are built into the game that'll help them to overcome those deficiencies. And so the teacher can use that as a tool in order to kind of, take care of the at-need kids in the classroom, or to have, kind of this virtual interactive environment with multiplayer interaction between the whole class. We have that option in this electronic space with this video game. Another big part, so our particular, unique feature, which is the EEG feature, that's key. That's where we see the future in terms of being able to assess. So we've talked briefly about being able to assess that expert state versus a novel state. Yep. What constitutes mastery? Well, we know from structural imaging studies that when you've mastered certain tasks, certain skills, that there's physical brain changes that take place. Now, we can't run everybody through a $3 million fMRI scanner, and it's just not practical. But could we put a $100 EEG set on everybody? Right. Yeah, it's possible in the very near future. And if we can reliably track, okay, what is your EEG signature at this expert level, and what is your EEG signature at this novice state, and can we get from one to the other? That's just one additional measure to assess whether you've actually, at the brain, at your the neuron, the synapse level, have you actually made these changes that make you a master of that particular topic?
Well, that's really where we started.
Yeah,
right?
It makes something that was formerly qualitative, right? Like, hey, yeah, you look like an expert, you're performing like an expert. Now it adds something quantitative to that, which is, I think, the power of the sensors and the power of these measures, particularly in the context of accelerated learning.
And I happen to think that you could think of it as accelerated learning in the way we've defined it for this panel, but I think in peak performance,
yeah.
Whether that's in a...
Yeah, oh no.
This will happen.
Yeah.
It's already happening.
Yeah, yeah. When I was thrilled to see the engagement and energy in the sports space on this as well. I think it's not, maybe it's not accelerated learning per se, but I think actually when you listen to, Brandon Marshall or some of the quarterbacks that we've discussed, and the actual intellectual load of some of those folks in terms of reading the environment and reading plays and knowing what to select, I think it has a lot of parallels there as well. So.
No, I'd propose we open up for questions.
Okay.
If we have the little blue box, there's a lot of engagement in the audience. Just looking out, people were sticking with this, so let's give you all a chance to ask questions.
This is, I want to kind of plan a virus with Amy and Sam, and John, you can do the math. Okay. But it's a different way to think about accelerated learning. So the fact is that the high school graduation rate has gone up, but that over half the kids who then go to the local community college flunk the placement tests in either math and or reading. So you can accelerate learning in the United States by fixing the things that kids aren't getting along the way. Now, I spent a lot of Bill and Melinda Gates money once trying to do an online developmental math course. And I had math learning scholars from both ends of the spectrum, traditional and progressive, Stanford and Berkeley, tell me that the main reason why kids in America can't learn algebra is because nobody teaches them fractions right. So if you could think about your platform and your portfolio and think about a way that could help kids learn fractions in the US, you would save the education industry billions of dollars every year.
Yeah. The idea that comes to me is that this has been actually a really good conversation because of the eclectic nature of the backgrounds, but trying to solve actually a fairly common set of problems.
Yeah.
there should be a really diverse group of people that get together to think about solving these problems in the way that you defined it.
Yeah, absolutely.
So yeah, I think looking specifically at algebra, to try to turn that into a question, looking at algebra specifically, there's a game out there that turns algebra into like this visual puzzle game where you start.
Refraction.
No, there's dragon something.
Yeah.
Oh,
something.
Dragon Box.
Dragon.
Dragon
I
Box.
play this thing.
Same
You start
one.
playing this game. It's a lot of fun.
Yeah.
And only when you're like 20 levels in, as somebody who knows some algebra, you realize you're learning algebra. So I hand this my 5-year-old now knows basic algebra concepts.
Yeah.
Right. This is one of the most brilliant examples of turning these things into a game that I've ever seen. And to maybe disagree, because we haven't had any disagreement on this panel, which is a problem.
I disagree with you.
There we go. So there was a discussion earlier
So easy.
about the importance of doing things in the classroom versus outside of the classroom, and I think doing things in the classroom is crucial. And I think one of the things that I've just seen, myself, one of the things I do is I give talks at junior high schools. They usually bring me in after career day because it's not fair to have the video games guy come in during career day.
Yeah.
But what they'll do is I'll do this session about using math in video games. And one of the exercises I'll do is give me something that you've learned this year in math class that you are absolutely sure you will never use ever again in your life. And when you ask your teacher, when will I ever use this ever in my life? Your teacher gives you it's the process that's important. Tell me those things, and I will give you an example right here of how we use that every day to make the video games you play after school. And I have never been stumped. And so I look at these things and I'm like, there are so many better ways to teach these concepts in class using either the game mechanics or the game development tools that we are using every day to build the stuff that these kids are playing. And somebody just needs to make that connection. I just want to say kudos to Pearson because they're getting a lot of flack for being this big, company. But actually, they've been very innovative in this. I've been pulled into some of their internal discussions, and I don't want to say anything about what you're doing, but they're thinking about it.
All right. Good.
Thank you, Sam.
Sure. Okay.
I appreciate
All right. We got who's got the mic? There we go.
I just spoke with someone today. His name is Ben Patton, and he's the grandson from George Patton. George Patton from World War II. And he does these multi-day filmmaking workshops on Army bases. And I was privileged to witness one of these workshops at Joint Base Lewis McChord,
Cool.
where they do virtual reality.
Yeah.
And one of the participants there was using this. So I spoke with him today, and he said, I don't see a value yet in virtual reality, and I'm trying to convince him for this next book that I'm writing that there is. I don't know if you can help me to address that.
Yeah. Well, I think one of the things about virtual reality, and one of the things that's always been the complaint from the simulation perspective is that it's just not immersive. And so I think there's a couple of things. I think now the quality of the game engines and the environments that we have from the game industry, not necessarily what the military is using, but from the game industry, has that look and feel and fidelity that now matches what some of those personnel expect to see. I think from an argument perspective, the ability to experience so many more repetitions and rounds and try out tactics, techniques, and procedures and really go through that repetition aspect is something that really gives the fidelity. The virtual reality piece, is still, we are so much closer than we were even 5 years ago in terms of the headsets and the portability and utility of those headsets. So many things that the military does are not done in isolation, right? They're done in squad formation, or they're done in division, battalion, they're done at scale. And so I think finding the right spot to implement some of those things, maybe it is at the 9-man squad level, to try a virtual reality exercise in that space might be, don't try to convince them at the battalion level. You're not going to make that argument. But I think a smaller scale, I think, is a very powerful thing that I think we can now do with some of the tech we have. So.
Okay, time for 2 more questions.
Hi, this question I guess is directed to all of you guys. When it comes to quantifying like these different performance metrics like creativity and critical thinking, I think Sam was talking about it earlier, like when it comes to like teaching algebra, why have you guys considered different modules to teach people like those critical thinking concepts? Because I grew up in, like I'm only 22, so I'm still on the younger end, and I grew up handwriting how to do calculus, and then I got a TI-89 and I just programmed it in and it did it for me. And then I was like, I still don't actually use this, and I ended up going to engineering school and leaving because I couldn't apply what I was learning in the classroom to solving real world problems. Like when it comes to like teaching, and I guess in your app with like Kunuro, like math problems, do you think it's, like how valuable do you think it is to teach people what 2 times 2 is for 4 versus now that we have Google and all these on-demand search platforms, you can actually just search it up and get the information.
So I think the
accessible.
question is is it still important to learn the fundamentals?
Yeah, like how
Right.
important is that, and how do you use, what
Yeah.
type of quantifying
Lisa,
metrics are you
probably,
using?
There you are,
Luis,
teacher.
Luis,
He's a teacher.
I'm so
right?
excited. I'm conflicted. So here's why. There's a great book by Daniel T. Wellingham. I think it's called Why Students Don't Like School. So I, at heart, based on what I saw in my own classroom, am a huge proponent of progressive educational models that say, allow kids to be curious about the world around them and train them to be kind of problem solvers and support that and coach them. That's great. Then I read this book, and it actually went into, all right, you have inputs and stimuli into the brain. Then you have it, correct me all, please, working memory, and then long-term memory. And what they found, what the book was arguing was that don't teach students how to be scientists. Because when you actually look at a scientist that is solving a really complex problem, their working memory is being spent on actually understanding the problem. A novice working memory is being spent understanding the words. And until they actually have those words embedded in long-term memory, can they actually grapple with the problem?
Right, yeah.
I think it's a little bit of both. I think it's really easy to say, oh, well, teaching fractions and drills is not worth it. We should all just do problem solving. I think it's a sweet spot with as most problems that have an and or.
Yeah, so maybe an accelerated way of getting those fundamentals kind of in place and then building off of that to a much more sophisticated
Exactly.
space. I
But
think that's a
imagine if
nice
the curriculum were then,
creative
and the
thing.
reason you're doing it is because you want your Susie pony to leap across that bridge to get her new sword.
Yeah,
Right.
and so that
This is a
segues
very interesting game.
Susie
Susie
Pony.
Pony and her son.
You heard it first here, ladies and gentlemen.
to our app, and the way that we're designing it is that we want, so we've created this entire game universe, which is based on this full-length narrative novel where we put that much time and effort into creating this environment so that the kids would be really engaged, they'd be really immersed. Why are they playing the game? They're not playing the game to learn math. They're playing the game because they're really engaged in the game and they want to progress through the different levels of the game. They need math in order to progress
Yeah.
through the game.
Yeah, it's built into the game
it's built
mechanic.
in. It's
Yeah,
very
yeah.
much, you need to learn this particular skill, which involves math, in order to get
Succeed.
to your next level. Your motivation is not to learn the math. Your motivation is to get to that next level. So it's actually applying it. And we have, in the digital realm, we can apply that in so many different ways that we can get translation from the actual skill that you learn
Yeah.
to translating that into real world applications. That's the beauty of this digital medium.
A short follow-up question about the video games. You were saying about collecting big data and like analyzing every single component when they're in the video game. I guess what limitations are you hitting right now with like privacy controls and parents worrying that maybe like the camera on their smartphones like spying on them or collecting critical information from kids so you can actually create this content that is individualized and customized to them? Are you guys hitting any roadblocks in the video game or app industry?
You could probably speak from a general industry standpoint. For us in particular, yeah, I mean, we have, so we have to convince people that we're not reading people's minds.
And then you
we're
have to
not
have
reading
them
your
wear the
kids'
headsets,
minds.
yeah.
We're not, so we have all these
could read
barriers to
kids'
overcome.
minds,
And that is one of the barriers to having adoption of this technology. But it's a matter of educating people. The problem with being a first mover is you've got to do that groundwork and educate people. The way we get over that is to show a real benefit in using this technology over not using the technology. And then you can start to overcome. I think the last year I was here and we had some write-up on us, and then we had somebody saying, they're just trying to read your kid's mind. It's like, no, we're not trying to read your kid's mind. The EEG doesn't do that. It's a completely safe. It doesn't, we have to convince people of all of that stuff. And we're confident. If I'm willing to use this on my own kids, that's my litmus test, right? It's very, very safe. And we go by strict, HIPAA guidelines. We go by FERPA guidelines in order to protect privacy. And so we meet all of those guidelines and exceed them in many cases in terms of encryption, data encryption, separating, identifying data from the actual data that we're collecting. but you're always going to run into that hurdle. It's just a matter of meeting all the criteria so that you can answer that question when it comes.
And from the video game standpoint, well, it depends on the segment you're talking about. If you're talking about really young kids, then we have COPA and other systems that are in place. In general, when we're looking at this volume of data, it's all completely anonymized. We don't know who's who. It's just a big soup of 10, 50 million players. But I think one thing that sort of came out that I think is important, that sort of I read from your question, is focusing on kids. But one important thing to understand about video games is that there, for example, are more women over the age of 18 playing video games than there are boys under the age of 18 playing video games. So video games is not, there's like this sort of stereotype as it's a toy played by 13-year-old boys, but the truth of the matter is that the average, even if you look at consoles, the average Xbox gamer is like 30 years old, and across the board, everybody is playing. It's 50-50 split across gender, and something like a third of people over the age of 65 are playing video games. So it is broadly adopted by the population. You don't get to billions of players without having this sort of broad demographic base, and that's important to understand for the applications and all
And with
these things.
that, we need to say thank you all for being a great audience, and what a fantastic panel.